Children's Hospital has been awarded nearly $3 million for its psychiatric unit. The money is coming from the New York State Office of Mental Health, and leaders say it will help improve suicide prevention protocols by expanding services for patients. The hospital says the money will also help support outreach efforts with community organizations. So joining us live in studio today is the manager of the hospital's Children's Psychiatry Clinic, Dr. Chelsea McCabe. Thank you for joining us on Most Buffalo. So we want to know, how will this nearly $3 million, it's a grant, how will it help suicide prevention efforts to help children in our area?
Yes, thank you for having us. We're super excited, or I'm super excited to be here. So there's a significant need for suicide prevention efforts. Right now, the rates of suicide have increased since COVID. And if you think about youth safety, there's campaigns for wearing a helmet, for safe sleep, for bullying. And we want to really improve and have more messaging for suicide prevention. So for example, locking up medication, or how do you directly ask a child if they're suicidal, and be able to provide resources to the community. So there are efforts in place already. There is Zero Suicide in New York State, as well as the Erie County Suicide Coalition, and we want to be able to use Oishei, who has a big reach, to be able to support those efforts.
And you'd all kind of just like work together.
Yep.
To help. So how will the clinic then use this money to address the rising mental health challenges that we've all heard so much about with young people going on right now?
Yes, so the funding will actually address rising mental health needs in a few ways. So one of the ways that right now we screen 45,000 patients annually for suicide risk, and in that response we're able to respond to all of the high-risk screens. The grant is going to allow us to actually respond to medium and low risk as well, and then also people who have no risk, right, that screen. What we hope for on our risk screening is also to be able to just give them tools and resources if their risk changed in the future. What do you do? We know that the more you can intervene upstream and not when people are in crisis, the more likely that you're going to have a positive outcome.
Right, and if you're having that conversation now, and also like your situation might change too, so it's not something where you just check in with somebody one time on.
Yes, and you don't want to be in crisis and not know what to do. So
right.
You give those tools when you're not in crisis so that you're able to use them when you are in crisis.
And somebody will remember, oh wait, at Oishei they were talking about this, and this is a resource we can go to. Hosting suicide prevention events is something that helps the community, obviously. So do we expect more of these types of events to happen with this money coming your way?
Yeah, so the great news is the grant is a 5-year grant, and Oishei is going to host 4 events per year, and we plan to partner with our community partnerships to be able to, one, see what the community wants and needs, as well as we envision having, like, similar to your car seat safety check, where you bring your car seat in, we're going to have suicide prevention events. You'll be able to come in, have a suicide screening, learn what the resources are. We also want to use this grant as an opportunity for hope. So we know that there's a suicide contagion effect, which that means if you're suicidal or you're surrounded by people that are suicidal or engaging in suicidal behaviors, you're more likely to be suicidal. Well, that same effect is true for hope. So we want to start spreading hope messages and methods of how you respond when you're suicidal, and things that are, along the lines of positive messaging. And then so this grant really gives us an opportunity to spread that hope and really improve suicide outcomes in Western New York.
All right, well, that was Dr. Chelsea McCabe from Oishei Children's Hospital. Thank you so much for spending part of your afternoon with us here on Most Buffalo. We appreciate it.
Thank you for having me.
Up next.